to us, Apollo is an institution which is responsible for the healthcare of the nation. So I think the whole mindset is different, you know. We're not doing it for ourselves, because by the grace of God our hospitals are full, our clinicians are excellent, and from 8,000 beds we'll grow to 10,000 beds. That's fine. So the business enterprise is okay, because we work hard and we're doing it well. The responsibility is for the nation and for the country. And that is where we have to, come up with ideas, innovations, policy changes, which will impact the lives of so many people.
When we talk about healthcare in India, and if you think about hospitals, the very first name that comes to mind is Apollo Hospital. What are the values, the aspirations, the competencies of the leadership that have resulted in your brilliant and successful strategy here?
Actually, I think it's very simple. It's a shared sense of responsibility, when you say there's a stamp, or we've got quality assurance programs, we're JCI accredited. It all really started because Chairman's single-minded focus about being patient-centric. Most institutions come into being because there's a crying need in society. Dr. Reddy came back from the US. He was doing brilliantly there those days. His father said, that's fine, what you're doing, how does it help India? So he packed up his bags and moved to India, and then started a practice in India, and then found that, that level of quality care, surgical interventions, our country is not geared up to give. The whole story started because, he lost a patient who could not go to the US in time for surgery. And then he said, we need to do something in our country. So again, we went ahead and built this hospital. This was the first one. Now we feel that, the entire healthcare landscape in India has to change. We're happy with what's happened, but we understand that, there are 1 billion people to be served. So what are the ways and means to do it? How do we give back to society? What can we do in the healthcare space? And we don't waver, it is healthcare and it will continue to be healthcare. And I think that's probably one of the reasons why as a strategy it's worked. And even today, 25, 26 years down the road, it's always been that, what can we do better for the people who trust us, who come to us from all over the country, from overseas, and how can we make our outcomes even better? So we're consistently challenging ourselves to, make things even better, even quicker, even more perfect than we can. Healthcare, you can never be perfect. But you can never stop trying, and I think that's really been inculcated in all of us who work for the enterprise, and all our employees feel the same way. It's very patient focused, patient centric, and really consistently raising the bar on outcomes time and time again. We do want to work deeper within our country because the opportunity as a business is large. The requirement to serve humanity is huge. So I think the focus will continue to be in India. But having said that, most organizations do want to be a global player because we know that we can contribute. So I think being a global player will happen, and we will see synergies between many countries on how healthcare is, handled.
You talk about touching 1 billion lives. That's quite, how shall I say, a reach goal. How do you translate that into practice?
When I say touching 1 billion lives, I sincerely mean we have to make a difference in 1 billion lives. And you can do that by working with governments, looking at public-private partnerships, trying and being able to change policy, so that it really, people can access healthcare the way they should. Because it's a fundamental right, and people are entitled to quality healthcare. And that's why I'd like to make a difference in their lives. Also today, technology has come to a level where you can literally, reach the length and breadth of a country like ours. So using telemedicine, using the kind of bandwidth which is going to be available, using 3G, we can access people in remote locations. So to just be able to, provide at least information to them that, this is what has to be done in an event, or this is the kind of healthcare you people are entitled to, I think will make a difference in their lives. And that, when I say touching 1 billion lives, in some way or the other in the healthcare space, we'd like to make a difference.
Again, if you could look at these challenging goals that you're setting for yourself, I think Apollo has been primarily in the urban areas in the last decade or so, couple of decades. When I was here last, you talked about expanding into the rural areas, and you're also going global. So in one sense, you are, how shall I say, facing up to multiple challenges in terms of going...
Two ends of the spectrum, really speaking. When we completed 25 years, when we went back to our chairman and we said, you know, we've done all this and we've treated 18 million patients and this is what we'd like to do in the future, you know, he stopped us right there and he said, yes, but you know, you people are serving the urban, what happens to people in the smaller towns and rural area? And that's why we worked on this complete strategy to go into the smaller towns. 10 of our hospitals are ready. We've managed to hire excellent clinicians and they will do high-end acute care. So, you know, we'll work with a hub and spoke model where, you know, a lot of work is done in the smaller towns, in the rural areas, but when they need maybe like a major quaternary care intervention, they will come to the cities.
There's going to be an interesting, how shall I say, opportunity and challenge in terms of appropriate technology at each of these levels. Are you addressing that?
Technology has to be accessible, both financially and technically accessible. And I think that those kind of models will have to evolve. Innovations will have to come into countries like ours. They'll have to be disruptive. They cannot be, you know, the usual whatever is available as a model. And I think people are really looking at it. They're, you know, they're like great, beautiful minds working on it. India has Sam Pitroda, who is advising the government, who's spending a lot of time with us, telling us what we can do in the healthcare space. So I think with people like this really, you know, wanting to make a difference, technology, innovation and all will happen. And if we don't ride the crest of the wave, I think as an organization we'd be irresponsible. So I think that's why we're really pushing ourselves to, you know, try and be ahead of what is happening, try and, you know, use innovation to provide the kind of healthcare which people are entitled to.
You're talking about this kind of innovation. You're doing things that have never been done before. And again, technology in medicine is moving at a rapid pace. How do you make the decisions when the choices are so difficult and the future is so murky? How do you make the difficult choices?
See, there are two kinds of issues with, you know, with technology. One is what will impact a clinical outcome. And that the choice is very clear. You know, the clinicians are involved with it. We work with some of the best centers abroad. You know, we have the cyber knife, which is, you know, the first in this part of the world. And we've worked with Stanford and we know the kind of outcomes which come. So we do that on the clinical space. And then there's the, you know, the telemedicine, the IT and that kind of technology. And that I think it's more, you know, we are the first movers. So we try and then we try and make it better each time. And, you know, work with people who advise us very well. So I think that we get it right and then the rest of the world copies us. So that's the way it's actually been working.
Your new children's hospital is absolutely state-of-the-art in every sense. I mean, it's welcoming, it's warm, and the information technology too is state-of-the-art. But it was very interesting in one sense. Can you make that accessible to the rural areas too? How would they afford that kind of outstanding care?
The biggest challenge in Indian healthcare, it's actually very simple. There's a geographical access and there's a financial access. Now for the geographical access, we have to be, you know, bring in methodologies like telemedicine, people going out there in big vans, large-scale screening, education, etc. For the financial access, you know, the affordability issue, good insurance programs are really the answer. And we have been advising many of the state governments and they've actually been doing very well now. Andhra Pradesh has a good model in place. Karnataka is trying. Tamil Nadu is, you know, pretty much there. And some of the northern states are looking at us. So I think if we have a robust financial model which is backed by insurance, people can access quality healthcare. Again, just a simple arithmetic, if a person can pay like 1 rupee a day, you're talking about 1 billion rupees a day. And you multiply it by 365. And that's what you have in the kitty to provide healthcare. And you can actually make a difference if that's utilized well.
We have always thought that you focus on a particular niche and keep tweaking a strategy to fit that niche better. But what you're doing is expanding both ways, to the rural areas, to the global context. And I was wondering if you could talk about how that actually advantages you as opposed to disadvantages you. That's the impression that I get listening to you, that it actually is something that helps you become more effective.
We've created like a hub and spoke model. And typically there will be like, high centers, state of the art, so on and so forth in the cities. And the smaller hospitals, which are typically 150 beds in the rural areas, which will feed into these. So they will handle high-end acute care, immediate care, but when it comes to interventions and things like that, the hospitals in the cities will handle it. So that's really how we've apportioned our capital. I mean, if we had unlimited supply of capital, we would have done it everywhere and been all over the place. But you do have to look at the enterprise. You do have to understand that where you focus, and where can one let's say one intervention really complement what you're doing in another location. So I think that's how we've planned how our beds will be apportioned between rural and urban. So you're really feeding two segments of the population.
And you get some synergy out of that, apparently.
There has to be a synergy. And then we're in the pharmacy retail business. So the pharmacies are located all over the place because people are really entitled to quality drugs. And so that is there. We have about 100 clinics spread all over the country, which is again going to scale up to about 300. We have vans which go out into remote locations and run camps and screening for people. So we are addressing both segments of the population.
Talking to you earlier, I heard an amazing figure. You talked about the need for 80 to 100,000 beds every few years to meet the needs of the country. That creates some enormous challenges, that rate of growth, that magnitude of growth. Could you talk about that?
That is the opportunity in the country.
I see.
You do need that many beds to serve, the people of the nation, people in this part of the world. But having said that, I know that we can find capital to do it. And not only Apollo. I mean, Apollo can't build 100,000 beds every year. The country can build our 100,000 beds. But the biggest problem is going to be able to, how do we man it? We don't have the manpower to handle 100,000 beds every year. And that is the biggest problem and the biggest challenge.
So there's got to be all kinds of innovations to address that.
Different kinds of innovation, different training for skills, and that's what Apollo is doing is that we're building Apollo knowledge cities in many locations. With hopefully in the next 5 years one will be up and ready in Andhra Pradesh. But we're looking at seeing how we can build 5 or 6 knowledge cities which will train manpower, for future generations at least. And I mean the magnitude is large. I look at it as an opportunity. Challenge has to be converted into an opportunity, and that's really what it's all about.
Could you talk a little bit more about these knowledge cities? I've heard a little bit about them, but I'd like to learn some more.
See, the Apollo knowledge cities are going to be, our cities of the future. So it will be typically like a township, and it will focus on, number one, education, high-end medical education, and also the support services. Technical staff. It will train pharmacists and radiologists and radiology technicians and stuff like that. So we're looking at every center turning out at least 5,000 to 10,000 skilled manpower to help in the healthcare space. That's on the training and development. Again, it will work with some of the best centers worldwide to try and to work on research. We'll work with the technology providers like the, the Siemens and the GEs and the Philips of the world to come up with disruptive innovations which will really be able to handle the healthcare needs of the world. So this is what the Knowledge City, the vision of the Knowledge City is going to be. And then look at, stem cell research, pharmaceutical research and things like that. So we will provide the space and the environment for people to come and do research and train manpower. So these are the the areas which we would like to work with.
I'm using the word amazing a lot in connection with Apollo, but this is amazing too because you're talking about the absolute cutting edge of technology and training technicians and support staff. So that's quite... the
healthcare today for institutions like ours is an end-to-end approach. We have to be able to give solutions for every aspect of being a healthcare provider. It's fine to build hospitals. I mean, we have to do that and hire manpower and go ahead and just run the business the way it is. But to be able to really create a healthcare revolution, change the landscape in a country, I think all this has to be done. It's not easy, but then that's what we're here for.
That's right, so you take these challenges and see them as opportunities. And that comes to a really important word. Listening to you, you are ahead of the game here. You're obviously on the leading edge in every aspect, whether it's the business model or whether it's technology or whether it's the kind of service you provide or the kinds of clients that you serve. And all this has got to be driven, I suspect, by something, a word you used a moment ago, by a vision. Could you talk about the chairman's vision and your vision as the CEO? 5-10 years from now, what you see the health landscape as and what you see as Apollo's role in the global and Indian health landscape?
It's interesting because, I find just listening to Chairman and working with him, his vision hasn't changed. It's just gotten, wider and bigger and kind of grown to encompass not only India but the problems of the rest of the world. Because, healthcare is a subject which is very dynamic. You think you've done it, but then you look at it and you find that there's like a, huge long road ahead. So I think how much more can you do in the healthcare space, but only the healthcare space is really what we'd like to focus on. Having said that, I think we'd like to work deeper within India, but get stronger globally. Globally what can we do in the healthcare space is more on a consultancy point of view, maybe invest in a few hospitals, but within our country, I think we really want to go deeper, look at every issue of healthcare, and that's why the Knowledge City to look, to handle the challenge of manpower and knowledge and research is there, building out hospitals in the rural areas because we know that's a very unserved population. Getting the urban, towns with better healthcare, a better infrastructure and network, so we're handling that. I don't know what else is left. We'd like to do that. Maybe the research aspect. Today Apollo as a group is not into, very high-end research, but we know that the sheer magnitude of the, the population we handle, there's a lot of data available for research. So how do we work on, the data we've accumulated over so many years? How can we turn it to, to serve humanity, advantage for people in the future, is something which we will look at as we go along.
One last question. I heard that when you were in Washington, D.C. just the other day, that the Prime Minister, Mr. Manmohan Singh, introduced you to President Obama and said that you and your father and the hospitals here have revolutionized healthcare in India. And I'm told President Obama said you could teach the US a few things about how to improve healthcare. Would you just mention a couple of things we could learn from you in terms of healthcare?
Well, I think number one is President Obama was absolutely charming to have said that, but he did. And I think what has happened to India is that, sheer lack of resource has made us more nimble and more quicker process driven and things like that. So the processes are very efficient, they're more cost effective, and we really give out the same quality of healthcare at 1/10 the cost. We've shown it, and it's happened. What has happened with the US is that, it's just so completely bogged down by a very litigative situation, and there are many layers. By the time, healthcare is actually given to the common man, the process is just so complicated that it's become expensive. So I think ways and means to look at the way India is providing healthcare at very competitive prices, and seeing how can we replicate this model in the US. How can we use the knowledge, the experience of India to, provide healthcare in a quicker, more cost-efficient fashion would be something very exciting for the future.